Today we will be discussing the positive Lyme disease antibody test in a simple and easy to understand way. Have you ever wondered why a Lyme disease antibody test might come back positive? Let's delve into this. Lyme disease, caused by the bacterium Borrelia burgdorferi, primarily occurs in the United States. Diagnosing it isn't straightforward and requires two types of tests. Initially, an ELISA, enzyme-linked immunosorbent assay, or IFA, immunofluorescent assay, followed by a Western blot test for immunoglobulin G, IgG, and immunoglobulin M, IgM. However, a positive test doesn't always confirm active Lyme disease. The antibodies detected, IgG, IgM, or both, can linger for years even after successful treatment, making it tricky to distinguish between past and current infections. Moreover, these tests can give false positives due to other infections like syphilis or viral illnesses, and even in autoimmune diseases like lupus. Therefore, a positive result must be interpreted cautiously considering the clinical symptoms and patient history. When does a positive Lyme disease test signal an alarm? Here are some critical scenarios. Negative Western blot after positive ELISA or IFA. If the Western blot, IgG and IgM, is negative despite a positive initial test, it generally overrides the initial result. However, if a characteristic rash known as erythema migrans is present, it might still indicate Lyme disease. Positive IgG and IgM in Western blot. This suggests an encounter with B. burgdorferi. If symptoms of early disseminated disease are present, it often indicates a need for therapy. Positive IgG, negative IgM. This pattern suggests a past encounter with the bacterium. Treatment depends on symptoms and previous medical history. Positive IgM, negative IgG. In patients with recent symptoms, less than 6 to 8 weeks, this can indicate early disseminated disease necessitating treatment. A false positive IgM result is possible, especially if symptoms have persisted for more than 6 to 8 weeks. In such cases, it's often due to other reasons or a past treated infection. After a positive Lyme disease test, what additional evaluations might be necessary? Depending on the situation, doctors might recommend repeat testing. If early disseminated Lyme disease is suspected but IgG is negative, a repeat test after 2 weeks can confirm the diagnosis. Testing for co-infections. If symptoms suggest conditions like babesiosis, anaplasmosis, or Borrelia miyamotoi infection, specific tests for these co-infections are advised. This is particularly important if symptoms persist after treatment for Lyme disease that wouldn't be effective against these other pathogens. Evaluating other conditions. In cases of suspected false positive results, testing for other infectious diseases or autoimmune disorders might be required. Be sure to follow up with your healthcare provider for the next step.